Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets.
Hey, welcome back to Between the Sheets. I am here with a guest today. We have Dr. Anastasiya today. She is an osteopath and wellness coach based in Melbourne, Australia. She specializes in migraines, women's health, endometriosis, and chronic pain. She is going to talk to us about how our nerves and our nervous system impact our sex lives as well as female pelvic health issues, including endometriosis. So welcome, Dr. Anastasiya.
Thank you. Going to be a very fun and exciting conversation. And I hope that I'm super excited, and I do hope that your audience can get as much value as possible from our chat today.
Absolutely. I'm so glad that you were able to be here and we were able to navigate the time difference and all of that, because I think you're very valuable to the audience. So talk to me about, first of all, how did you get into this? Was it from your own experiences, or did this just was this your love all of your life? How did you get into it?
Personal experience.
Okay.
I've had a huge heap of chronic conditions pretty much since I hit puberty. Endometriosis, PCOS, adenomyosis, fibromyalgia, and kind of the list just goes on. Chronic pelvic pain. And I kind of really, really struggled through my teenage years, particularly because I didn't grow up in a family that was particularly health literate. It was narrative that all women have periods, right? Therefore, what you're experiencing is normal. And I kind of grew up with that. And it wasn't until it kind of got to the point where I was barely coping. I'd, had a few suicide attempts. I had massive insomnia, massive anxiety, massive depression. And going through the medical system was honestly awful because nobody could figure out jack shit. Pardon my friend. Nobody could figure it out. Nobody could give me the right answers. And there was huge gaps in our system when it comes to care and medical gaslighting, particularly when it comes to women and our cycles and the consequences that come with having chronic conditions. And that's when I kind of really knew, okay, I already knew I wanted to go into the medical field, right? And my own personal experiences and the gaps within the medical industry that I'd witnessed kind of really narrowed me down into women's health.
Okay.
And and I've, fallen in love with osteo. I've fallen in love with coaching and trying to create as much education and resources and help women to be able to advocate for themselves.
Yeah.
You don't know what you don't know. And if you don't know, then how are you supposed to stand up for yourself? How are you supposed to advocate for yourself? And the shitty part is a lot of these topics are still considered super taboo. Especially when it comes to, your sex life and how that impacts your sex life too.
Right.
It's still, even, just periods. Kind of like a hush-hush topic.
Oh, yeah. Yeah, I absolutely agree.
That's pretty much in a nutshell how I kind of got into this space and into my industry. And
Awesome. So I know that one of the things that you focus on is women's health and particularly pelvic issues and endometriosis. We have not talked about endometriosis on this podcast yet. So I would love to kind of delve into that off the bat and talk about it. How do women work through that? Because I know that it does impact their sex lives because they might have irregular periods or heavy bleeding or pain with sex, or there's so many things. So talk me through endometriosis.
So endometriosis is there's a few different ways to classify it, and we're kind of slowly going down the path of it acting like a autoimmune disorder, an autoimmune disease, right? And I'll talk a little bit more about how and why that is. But it's ultimately a chronic inflammation condition, right? So it's where endometrial-like tissue, and we call them endometriomas, grow outside of the uterus, right? So inside our uterus, we've got the endometrial lining, and that changes and shifts depending on where we are in our full, 28-day cycle. And once we kind of hit certain levels of hormones, our lining will shed. But what happens with endometriosis is these growths and adhesions can grow everywhere. They can grow outside of your uterus. They can grow over your ovaries. They can grow over your intestines, in your stomach, like over your stomach. And some super rare cases is like in the lungs, in the nose, in the eyes. And it's one of those things that it's not just a bad period. There's so many symptoms and so many issues that arise with endometriosis, particularly if you couple that with adenomyosis, which is similar to endometriosis, but those growths grow in the actual muscular tissue of our uterus, right? So that's about the gist of it.
Okay. And how, when women are coming to you with this issue, what's the biggest thing that they come for? Is it irregular periods? Is it pain? What are they seeking help with?
It's heavy periods. It's chronic pelvic pain. It's pain with sex. It's worries about, infertility. It's, chronic pain. It's bloating. It's gut issues. It's PMDD. So, really, really severe like PMS. It's everything is driven with fear, right? So for a lot of women, and myself included, endometriosis was their whole entire life revolved around it. Every action that they took, every decision that they made, whether it was that social activity, dinner with friends, spending time with your kids, spending time with your family, or even things like career choice. Everything revolves around fear and the crippling symptoms that come with endometriosis and chronic pain. So a lot of women come to me when they are at breaking point, where they're in such a bad state where women can't show up for their family, women can't show up for their kids, women can't show up for themselves. They're losing jobs because of the, how painful and heavy their periods might be, and the endo flares that you get outside of your bleeding. So it's kind of hard to narrow down one specific thing, but if I could summarize it, it comes down to women are just at breaking point.
Yeah. So what kind of interventions do you have? How do you help them navigate having this issue?
So it's a little bit different with my osteopathy and my coaching. I kind of went into coaching because of the limitations that I had in terms of my scope of practice with osteo. But with the osteo side of things, it comes down to education, so actually teaching women about their bodies. And it's insane the amount of women that don't understand what a period even is. Even if we're just taking away any conditions or any illnesses, so many women don't know what a period is. They don't know their own anatomy. They don't know how their body works. It's just not taught. It's not taught in schools. It's not taught through their family and their female connections, because they're also not taught. So that's the most important part, in my opinion. Then it comes down to manual techniques. So I will treat through the vagina. I'll treat out of like through the pelvic region. I'll also treat, sometimes I'll treat the feet because of the anatomical connections between our uterus, our pelvic floor, and our feet. So there's a massive fascial connection. I'll treat the skull and, the neck region through craniosacral therapy. And so it's a little bit more hands-on. And I give them exercises and, things to kind of take home with them. And it also kind of comes down to mindset shifts, is how women talk to themselves, how women view their bodies. And with coaching, it's all of that and then some. That's when I can talk nutrition. That's when I can talk about somatic healing. That's when I can talk about trauma. That's when I can talk about and educate a lot more in comparison to osteo.
Yeah, that's very interesting. And are there any tips that you have for women who particularly have issues with pain with sex?
So in terms of that, it manifests itself very differently for different women. So for example, one woman might not necessarily have painful sex, but she will bleed after she's had intercourse. For another woman, it's incredibly painful when you just have that initial penetration, and then afterwards it feels fine, right? For some women, the whole entire experience is painful, right? And part of that also kind of comes down to how women perceive their body, how women feel about their body, because we kind of manifest what we think, right? And so my biggest tip for women is to actually explore, whether it's with their partner, whether it's with themselves, positions that feel comfortable, that feel good, and that don't cause bleeding afterwards. And typically you'll see that in a lot of deep penetration intercourse. That's when a lot of women will experience pain, bleeding or discomfort during or after sex as well. So that's probably my biggest takeaway, is actually explore, right? Explore your body with someone, with yourself, with toys, with whatever it is that you're comfortable with. Explore and, do what feels good, and to try and remove the bit of the fear around it as well. Because if we're afraid, or if there's some level of apprehension of, it's going to be painful, I kind of don't really want to try, it's, I've done this, this, and that, and, I'm still going to have a negative experience, that in itself is going to cause a woman's pelvic floor to tighten and to kind of go into this guarded response. And that's when it can become even more uncomfortable and more painful as well.
So what tips do you have for the women who have endometriosis and it is affecting their sex life? What are some things that they can do?
There's a couple of different angles that you can take from this question. The first is a fear-based mindset or apprehension about having intercourse, because women know that it's going to be painful, they know that it's going to be uncomfortable, they know that they're probably might have an endo flare after intimacy, or they might be bleeding after intimacy, or there might be a lot of inflammation in their uterus as well. So my first piece of advice that I always give to my patients and my clients is kind of accept that it might be uncomfortable and to not be so afraid of it. And I don't mean accept in terms of accept it because that's your life and like kind of get over it, but more of accept that maybe you can't do certain positions at this stage. Maybe you can't do, certain spicy things at this stage. That's completely fine, because you can build up to that. Because the second that we become afraid or apprehensive, our pelvic floor tightens. right? Have a reflex within our pelvic floor where our pelvic floor will contract with any stress, anxiety, so any negative emotions that our nervous system, our brains, and our bodies perceive as a threat. And sometimes it's our own thoughts, right? And to kind of navigate around that is experiment, be playful, whether it's your partner or whether it's with yourself, and toy. Figure out what feels good for you. Figure out, what positions are, don't not only feel good, but also comfortable, and what things will free you up. Because when we kind of think about it, the world is our oyster in the bedroom, right? We can do whatever that we want, whatever tickles our fancy, whatever is, local. And it doesn't always have to be a bad thing, right?
Yeah.
And so experiment with your partner, experiment with toys, experiment with your fingers, and introduce other sensations too, right? So this is where foreplay becomes super important, whether you partner or you've got some solo spice state, stuff going on too.
Yeah.
So be a bit more lighthearted about it. Be a bit more cool, add more sensations to your body. And this is also kind of when it comes to embracing womanhood and embracing sensuality too. Because sensuality doesn't mean sexuality. Sensuality is experiencing everything through all of the senses, right?
Yes.
And so that's kind of the biggest tip that I give. It's two sides. So it's the kind of two sides of the same coin, is experiment and be playful, and also kind of feed into you being less fearful and less apprehensive about it. But then it feeds into being playful too. So if you're not afraid to try new things, if you kind of don't go into an intimate scenario, being fearful, being apprehensive, and kind of having that what if, already kind of setting up yourself for not failure, but for discomfort. So, you are what you think. So if you kind of come into that scenario, it's just like, this is going to be painful. I know it. It is painful. Right? So you're almost creating and living an experience that hasn't even happened yet.
Right.
So those are kind of my two top ones, but there is heaps of other things to play around and experiment and talk about in that area.
Yeah, I'm really big on self-time, whether you use it to climax or not, finding out what touch feels good and bad and all of those things, so that then you can communicate with your partner. And so, I do that as just a baseline anyway, but I can imagine how if you have a pelvic condition like endometriosis, how much even more important that is, so that when you go into these situations that potentially could be painful, you know what to tell your partner and how to, what does actually work for you and feel good.
Absolutely. And it also kind of ties in with how you talk to yourself too. Because if you don't give yourself grace, if you don't talk to yourself with compassion and kindness and love and appreciation, that will also manifest itself within your pelvic region too. Because as women, we hold on to a lot of emotion within our pelvic girdle, within our uterus, within our pelvic floor. So talking to yourself with kindness, and even sometimes just literally looking like dead in your eyes, in like your own eyes, in the mirror, and saying things like, I love my body. My body is, I love every squishy bit. I love every curve, every crevice. I love everything about my body. Because if women don't feel good about themselves, which is really, really common with endometriosis, PCOS, and, prolonged chronic pain,
Yeah.
you almost start to resent your own body.
Yeah. I can imagine.
If you have those feelings towards yourself, then you're not going to be able to actually enjoy a sexual experience, regardless of whether it's with somebody or a solo experience,
Yeah.
right?
Yeah.
So just changing the way that you look at yourself and the way that you look at yourself, because, every single woman does this, like in the morning when you're brushing your teeth or when you're doing your makeup, how like many thoughts of imperfections run through your
Right.
mind, right?
Yeah.
I'm like, I've got acne, I'm breaking out, or my eyes are together, or my skin doesn't feel good, or
Right.
like cellulite, or I've got stretch marks.
Yep.
That is how women talk to themselves when they look at themselves in the mirror. So
Yep.
if you change the way that you talk to yourself, if you change the narrative, that is another aspect of being more comfortable with sexual experiences.
Yeah, for sure. Yeah, I can think of, a couple different examples of philosophies out there where, you stand naked in front of the mirror and say 3 good things about yourself. Mel Robbins says you high five yourself in the mirror every morning, things like that. I've put sticky notes on my mirror to remind myself of things, all the affirmations and things like that. It is. It is. And it's so important for all kinds of aspects, but especially just feeling good in our own skin, which allows us to have a better sex life.
Yeah.
What other pelvic issues do you help women with?
Pelvic dysfunction,
Yeah.
incontinence, constipation, pelvic pain as well.
Okay.
There's so many things that kind of come into that pelvic girdle region. But
Yeah.
I even do a lot of somatic
Okay.
work with my patients and my clients to help release negative emotions, and not necessarily about sex or about intimacy, but sometimes it can be past experiences that we kind of mentally either can logic our way out of it, or understand that, okay, we feel like we've moved on mentally, but our
Yeah.
nervous system and our body still holds on to that, right?
Yeah.
So oh my goodness, there's so much that we can do when it comes to like pelvic health and pelvic floor stuff. I could literally just yap about it for like 4 hours plus.
Yeah, it is. It's a huge part of our lives. And it's interesting because, working as a urologist, I also deal with, the incontinence and the pelvic pain and things like that. And it always floors me how much people think that pelvic floor physical therapy is just, oh, yeah, I'll get to that someday, or maybe I don't have time for that, whatever.
Yeah.
And yet my patients that go, how life-changing it is.
It really is.
It's just amazing. And maybe you can speak a little bit more towards some of the things that women can do to kind of, relax their pelvic girdle and have more enjoyment in that area just throughout the day in their life, and then again related to sex.
Absolutely. I love this question. Oh my goodness. You can kind of come at it at so many different directions, and some kind of seem super random. Like, for example, if a woman's constipated, right, she is going to be bearing down a lot through her pelvic floor, right? A lot of inter-abdominal pressure, a lot of strain to actually toilet, right?
Yep.
When we are really, really constipated, that in itself can lead to a lot of pelvic floor tightness, right?
Yep.
So the way our kind of pelvic floor works is it works in tandem with our diaphragm. So it's almost kind of like a rhythm within itself to monitor and to shift our abdominal pressure. And the way that the pelvic floor contracts and relaxes is when it's contracted, it kind of shortens and lifts, right?
Yep.
Women who are, for example, constipated or are in a state of chronic stress, or their nervous system is really, really dysregulated, pelvic floor is constantly kind of shifted upwards, right? So when we are trying to either toilet, pee, or when we're trying to even do some basic things like picking something up from the floor, washing the dishes, brushing your teeth, we're kind of bracing, but our pelvic floor there's nothing else to contract. Like it can't get any shorter.
Yes.
So the first kind of point of call when it comes to pelvic floor stuff is actually lengthening and relaxing it, right?
Okay. Yep.
There are lots of different exercises that we can do. The first one, probably the most simple, is kind of like a reverse frog position.
Mm-hmm.
You know how you've got the frog leg position where you're on your back, got your knees like dropped to your side and your heels together, but doing that on your tummy with a pillow, for example, underneath, and almost like rocking back and forth, right? Because what you're doing is you're also increasing hip mobility, and a lot of the muscles that attach to our hips are actually attaching to our pelvic floor. So our pelvic muscles go into our hip as well. So you've got that lengthening of the pelvic floor, but then you're also creating more mobility and more movement through the hips too, which a consequence of that is lengthening of the pelvic floor. And you can couple that with breath work. So, for example, breathing in and breathing out through the diaphragm and syncing up your breath with every single rock. So it's nice, slow, and like rhythmic and smooth. That's kind of one way to do it. That's also a really, really good somatic exercise. And tries to release pent-up emotions, stored emotion. So a lot of women that I've prescribed this exercise or we've talked about, even myself, will sometimes just out of nowhere start like bawling our eyes out. It's full water, like full tears, full on ugly crying. For some women, they just get a surge of anger and resentment, and it just really fires them up. But that's a really, really nice beginner exercise. Cat cows are also fantastic with a little bit of a variation.
Okay.
Cat cow exercise, but under one knee, you have like a yoga block or like a really deep block so that your pelvis is slightly shifted upwards.
Okay.
Then you're going to have an even more like expansion and opening of that pelvic floor. And then your cat cows in that position. That's a fantastic one. So like there are so many different, there's so many. Pigeon pose is also a really, really good one.
Okay.
Stationary pigeon pose. Once again, you kind of get into that position and then you in and you rock out. You rock in, you rock out. So you've got that lengthening of the pelvic floor, the relaxation of the pelvic floor, and then you also have improvement of hip mobility, right? Couple that with breath work, and yourself a really, really nice combination of it's a good starting point.
Yeah, absolutely. I even had a patient who she had trouble just relaxing enough on the toilet to get her urine out. And I was just, I had heard about breath work and stuff from talking to my pelvic floor physical therapists that I refer to. And one of them had said, really make sure that your ladies are belly breathing because so many of us chest breathe. That if you breathe your air into your belly, that does what you're talking about with the diaphragm relationship. And it just naturally puts a little pressure on the bladder to help you release your urine. And I thought, what a great tip. And that is so easy to do. And I had one of my ladies come back and she was like, so you're telling me I've been breathing wrong this whole time? I'm like, well, apparently, like, I don't know what to tell you, but if it works, it works, So I love finding little tips and tricks that, can just make life easier and better. And these poses sound great.
And with belly breathing is fantastic. But something that I have noticed, especially because I'm a bit of a yoga and Pilates girl, is a lot of the time that we're taught to breathe with our bellies, right? To kind of push out our bellies, to expand bellies. But we're not taught to expand our lower ribs. So we're kind of said, breathe through your belly, right? Kind of push out your belly so that we kind of activate the diaphragm, but we're not activating the diaphragm to its maximum capacity. So I'm just going to suck in and then do a really dramatized example of this. We've got like flat tummy, and women are taught to breathe out this way.
Yep.
Yeah, but if we look on it sideways, and I want you to focus on this section through here, see how there's not a lot of expansion through the ribs? What we ultimately want is, yes, we want this to come out, but we want the lower ribs to lay outwards. And a really good way to kind of monitor that is literally put your hands on your lower ribs, fill up your belly, and then kind of fill out into your hands.
Okay. Yeah.
Move it.
Yeah.
And then that's it. So we kind of want that opening and closing of our belly, but also our lower ribs too.
Yeah, that makes so much sense.
Because if you think about the anatomy of where our diaphragm attaches, it's along those lower ribs and kind of under that. So it sits almost flat and transverse against, like, through here. So if we're not getting that rib expansion of where the diaphragm is actually attached, you're not activating the diaphragm to its maximum capacity. So belly breathing is fantastic, but we need to be incorporating that expansion of the lower ribs, of flaying them out a little bit.
Yeah, that makes so much sense. Do you have any tips for women who particularly have pain with intercourse? Maybe they don't even have endometriosis, but they're not constipated, but their pelvic floor is tight and they have pain with sex.
It depends on what stage of intercourse is painful, because for some women it's literally just penetration, right? So it's that first, inch, the penis or their toy that comes in, or even the fingers sometimes. It's painful. For some women, that's fine. But then when you kind of have deeper penetration and sometimes even hitting the cervix, that's when it can be painful. So first thing for that is, besides, make sure you're lubed up.
Yeah.
Like whether it's natural lubrication or whether it's like water or oil-based lube. So you can get creative with that. But also, especially if, for example, it's just the penetration, right? It's being a little bit more mindful. Like, I know sometimes we kind of get so hot and heavy that we just like, we need it right now. I need it now.
Yeah.
Well, slowing that process down just a little bit and kind of taking it like centimeter by centimeter, inch by inch, right? And breathing through it.
Yeah.
This, though, women actually need to learn how to relax their pelvic floor and what it feels like to contract it too. Because sometimes when women try and contract, they're squeezing their glutes, they're activating their abs. So they're activating everything except the actual pelvic floor. And so, learning how to contract it and then how to breathe out of it. And breathing out of it is almost going to feel like you're peeing, like you're trying to pee. The women that are listening to this, next time that you go to pee, I want you to really, really focus on the sensation of when you start the urine stream. What does it feel like? And then practicing stopping and starting. So have a steady stream first. See how that feels. Then feel what it feels like when you stop. Try and hold it just for a couple of seconds, and then try and pee again. And then have a little bit of a stop-start peeing stream.
Yeah.
And see what that feels like. But then also see what else are you feeling? Are you feeling like you're squeezing your glutes? Do you feel like you're bracing for it? Do you feel like you're trying to push down rather than ease into it, right? So that's kind of the best way for women to understand the sensation of contracting and relaxing their pelvic floor. But the contraction itself should be so small, so small. And a really, really good way of doing the toilet trick is oiling it with your hands. So what you want to do is when you're sitting down or when you're even just meditating, having a moment, whether it's, 5 minutes, a couple of minutes, is you want to place your hands kind of here. So we kind of want our fingers almost like right at the hairline of like where your pubes are, and flat kind of across in like this little V love heart finger. You want the pressure to be super light. So you don't want to be digging it. It's really light. You're literally just placing your hands on there. So, and then when you contract your pelvic floor, so when you squeeze, almost like you're trying to stop a stream of urine, is you should feel in this section, tiniest shift in movement. It's tiny, like it's really, really subtle. See how, like, I don't know if you can see or not, but I'm going to do like a true pelvic floor contraction and then one where I'm recruiting the rest of my muscles. And I want you to pay attention to my hands and to kind of this section as well. So this is a true pelvic floor contraction. See how there's nothing really happening visually? But now I'm going to contract with the incorporation of my abs and my glutes.
Okay. I can definitely see that.
Yeah.
Yeah.
That's what a lot of women do. So sometimes even just standing in front of the mirror so that you have that visual guide, having like really, really gentle palpation where you should only be feeling it in this section. Your hand shouldn't be moving a lot and you shouldn't be feeling any contraction in this part of your hand.
Okay.
It's literally just your fingertips.
Just the fingertips. Okay.
Yeah.
What a great exercise. I love that. So for those of you that are listening, pop over to the YouTube channel so you can see what she just did, because I think it's really beneficial to actually have the visual. That was awesome. Thank you so much. So tell me something else in your practice that really just improves people's overall quality of life, which then obviously leads to, if our overall quality of life is up, then our sex lives are better too.
The pinnacle of this is going to be cycle syncing. Cycle syncing lifestyle. So tracking your cycle and, having a good app that allows you to also track the different phases of the menstrual cycle and actually syncing up your lifestyle, your work habits, your diet, even, for example, your workouts, depending on where you are in your cycle. So, for example, we have 4 phases in our cycle, and day 1 is our period. So that's our menstrual cycle. And typically like anywhere between 5 to 7 days. That's kind of your first phase. When you're in this phase, you want to be taking a step back. It's about resting. It's about being slow. It's about being gentle. It's about having more intentional, introspective thoughts, introspective reflection as well. That's what you want to be doing in that period of time. You also want to be, this kind of goes back to before patriarchal society. And before society was based around the biology and the habits of men, right? Because back in the day, women's cycles would sync up together at the same time during the full moon or the new moon.
Okay.
So if we properly cycle sync, women collectively would be having a period at the same time. Right.
Yeah.
And it was a community around that, right? So seeking interactions with other women, connecting with other women, It's kind of almost our most intuitive time, which is very, very interesting. And having those connections, and I understand that that could be really, really difficult for women who have PCOS, endometriosis, because a lot of the time pain can be super crippling.
Yeah.
But you're in it for the long haul. If you start small, start tracking whatever it is that's happening in your body and figure out where you are in each phase. And sometimes the easiest way is to literally just start with your period, making sure that you're eating nutrient-dense foods, good food as well, and that you're supporting your body, right? And that you're kind of taking a step back, that you're not hustling, you're not overworking yourself, that you've got more downtime, that you've got specific rituals in place that soothes you, that allows you to slow down. With every phase, our hormones will shift and fluctuate depending on what levels of our hormones are, both our reproductive organs like estrogen and progesterone, but our androgynous hormone testosterone, depending on what they are, your body is going to be more susceptible to some things and less susceptible to other things.
Right.
So, for example, if we're in our luteal phase, that's also a time to slow down, right?
Okay.
That's you want to be going for gentle walks, gentle movement, a lot of honing in on pelvic floor lengthening and pelvic floor relaxation, and even supplementing.
Okay.
Different supplements for different phases of your cycle.
Okay.
Your follicular phase, for example, that is when your energy is at its highest. That is when you want to be doing the weightlifting. That's when you want to be hitting the gym. That's when you want to be really hyper-focused, for example, on your work. That's when you're at your most productive. You have so much energy to burn, right?
Yeah.
But at the end of the follicular phase, we kind of have that drop down and you find your energy waning a little bit. So actually syncing up your lifestyle and your work, if you have that flexibility, because I understand not all women have the luxury to, for example, slow down in certain phases of their cycle to hit times a month, because you still got that 9 to 5. You still
That's
got
right.
So it's kind of about, educating yourself and understanding what you really want to be doing in an ideal situation, depending on where you are in your cycle, and then implementing as much as you can that's realistic for you of those habits, for example, of those specific foods, of those specific supplements, and taking it from there. Over a period of time, your body is going to naturally sync up. Spend more time outside. That's the other thing. We're constantly inside at our computers. We don't spend enough time outside and fresh air, direct sunlight, particularly as we've got the different phases of sun exposure too. That's also really, really productive in terms of regulating our hormones, regulating our circadian rhythm, and actually kind of almost syncing up a little bit more with nature and with the phases of the moon too, right?
Yeah.
So that would be kind of my pinnacle advice is to cycle sync as much as realistically possible for your lifestyle.
I love that. That's such great advice. And I know there are a bunch of apps out there so people can find free ones you pay for, I'm sure, all over the place. But wow, you have just been so enlightening today, and I really appreciate this conversation. I think so many women are going to appreciate this conversation and all the practical tips and exercises you've given us today, which is amazing. Thank you so much for being here.
Oh, it was my pleasure. I love talking about this stuff. This is like my...
Yeah, well, your passion comes through and it is just contagious and it's amazing. So thank you so much. And for everybody listening, thanks for listening, and we'll see you next time on Between the Sheets.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.